new therapies that are coming, nerandomilast looks like it's going to be approved. The phase 3 data was recently released and looks very good. So likely this is going to be coming to market. It is a phosphodiesterase 4B inhibitor. It is also having antifibrotic effects and immunomodulatory effects on patients. It's twice a day dosing, and the 2 trials that we got some information out of was FIBRONEER-IPF and FIBRONEER-ILD. So they looked at patients that for 52 weeks, they were randomized either to 18 milligrams twice a day, 9 milligrams twice a day, or placebo plus whatever background therapy they were on. And then they took patients with DLCOs 25% or greater and the forced vital capacity of 45%, or greater than 45%. And they had to have stable antifibrotic therapy at least 12 weeks before coming in. And then they also looked at the efficacy of changing their FVC from baseline. So were they able to slow it down still, this disease, or stabilize their FVC, time to acute exacerbation, hospitalization, or death. And then they were looking at safety side effects that were reported, such as vasculitis, depression, and suicidality. So what they, as far as like the patient population that was in it, about 27% of those patients were the autoimmune phenotype of patients. So they took up a good portion of the patients in there. And then I don't know if you can read that from that far away, but the teal color is hypersensitivity pneumonitis, unclassifiable. Again, we have a lot of unclassifiable interstitial lung diseases. We're not quite sure what it is. And then idiopathic and non-specific interstitial pneumonias, and then other were in there as well. So looking at the results, oh my gosh, it's so tiny on my screen. I don't know how you guys are going to see it. This is some of the data looking at, oh, I should even wear my glasses. So change from baseline in forced vital capacity in the patients. They were able to show this is decline in lung function over time. And so the arms that were getting therapy did better than the placebo arm. You can see they lost more forced vital capacity here. This is patients taking background and tentative therapy and how they did with their lung function. So this, I believe, was monotherapy, if I'm reading it right with my squinty eyes. And then this was patients who were on background antifibrotics coming in. So nerandomilast was added to it. This is patients taking background antifibrotic therapy here. And then this one is one's on pirfenidone specifically and how they did as far as loss of lung function. This is the high dose arm, the dark blue. The patient's getting 18 milligrams. And then this is the low dose arm, which is the 9 milligrams. And then this is the placebo arm here, plus their background therapy. All right, this is change in FVC over 52 weeks overall trial population. So this is kind of the pooled analysis, everybody that was in the trial based on whatever they were on, no specific therapy. And again, high dose arm here, low dose arm here, and placebo group here. And this is change in their baseline FVC. This is patients taking nerandomilast, the monotherapy, I think, background, nintedanib, sorry, background nintedanib, high arm, low arm, and placebo group, change in from their baseline FVC. And then this is change in FVC on patients taking nintedanib. One must be FIBRONEER, I don't know, I need help from BI on this one. Hard to read those, what exactly they are, but looking at the curve of what's favoring the nerandomilast group versus if they cross this line is favoring placebo. So there was separation in these therapies in all groups there. All right. Side effects as far as safety. So if you're seeing patients in your clinic that have been started on the new antifibrotic therapy, we're still having some GI side effects with this therapy. You know, it seems to be a little lower than what we saw with the other antifibrotics, which is nice, but there still was higher than placebo group. Coughing, which is a very common symptom of IPF, was reported in the placebo group, but was higher in the treatment arms. COVID-19 had to be reported during the trials, was a little higher in this group here. I think this is supposed to be the 9 and the 18, but they actually put 9 for both of them. Dyspnea, again, these patients tend to be dyspneic anyway, but was different than placebo, where the treatment arms had less dyspnea than the placebo arm there. Nasopharyngitis was actually higher in the placebo arm as well. This is the FIBRONEER-IPF. This is the FIBRONEER-ILD study. So this was the patients who had other progressive phenotypes outside of IPF. Again, same kind of similar profile of symptoms and side effects. Nothing was kind of shocking there. All right, some other emerging therapies that we might be seeing come out over the next year or two are listed here. So there's a couple phase 2 trials going on. You know, we start to wait for phase 3 to kind of give us a little more information on efficacy, safety, and side effects that patients are likely to encounter. And these patients, it's another BID therapy, which is nice. So not the 3-time-a-day therapy is so hard for patients to be compliant with anyway, especially when it gives them a lot of GI side effects. Here's another therapy. I'm going to try to get through these pretty quickly because I know we have to get to our breakout groups. Treprostinil, we've been using for group 1 pulmonary hypertension. It was one of our first drugs to get approved for group 3 for patients who had ILD-associated pulmonary hypertension, and now is being looked at for pulmonary fibrosis patients outside of having pulmonary hypertension. So this will be its first indication outside of pulmonary hypertension, which is pretty exciting. Some of their data was released pretty recently, and there's going to be some more data released here soon at CHEST. The INCREASE trial and the TETON trial, the 2 trials, if you want to look those up, that talk about their data and some benefits that we might be seeing. There's been other inhaled therapies tried for interstitial lung disease that unfortunately have been negative studies, but this one has given us some hope. All right, other emerging therapies are combination therapies that are likely to be coming out in the next 5 years. A lot of different mechanism of actions coming, so more to come. You'll be hearing lots from your pulmonary cohorts there.